Medicare and health insurance in general can be confusing enough without technology thrown into the mix. Now, if you're looking to peruse your options, you can of course log on to Medicare.gov, that's Medicare.gov. But for those of us that are less than technologically inclined, it may be a little tricky. So today we're going to give you a walkthrough of Medicare.gov. Hi there, my name is Sarah and I'm here today with iHealthBrokers, so welcome to our channel. Now, we release these videos on a weekly basis designed to educate and inform people about health insurance and Medicare in general. So if you haven't checked out our channel, make sure to check it out and subscribe as well, because there are definitely a lot of helpful videos that can probably answer quite a few of your questions about Medicare. Now, like I said, today we're going to be covering Medicare.gov, that's Medicare.gov. And if you have any questions whatsoever, please feel free to leave them in the comments below, or you can give us a call here at iHealthBrokers at 888-410-0344. We're licensed health insurance brokers and we're licensed in all 50 states, so we're more than happy to help. You can access Medicare.gov year-round, whenever you want, but you can only enroll during certain times. On Medicare.gov, you'll be able to peruse all of the different plans available to you, and of course, you can also find forms, a glossary of terms, and many helpful help articles to answer some of your most frequently asked questions. Now, on Medicare.gov, you'll be able to peruse plans for Medicare Part C, Medicare Part D, and Medicare Supplement plans, also known as Medigap plans. For original Medicare, which is Medicare Part A and Medicare Part B, you'll need to go through Social Security. So now, like I said, for Medicare Part C, Medicare Part D, you can only enroll during certain times. You can enroll during the annual enrollment period, which is every year at the same time, from October 15th to December 7th, or you may qualify for a special enrollment period. Medicare Supplement plans are a little bit different. You can actually enroll in a Medicare Supplement plan year-round, whenever you want. However, it behooves you to do so during your individual open enrollment period. Now, for Medicare Supplement plans, that's the 6 months after you turn 65 and have enrolled in Medicare Part B. At this time, you will not be subject to medical underwriting, but if you choose to enroll outside of your individual open enrollment plan, you may be subject to medical underwriting and therefore be denied. Okay, so first we're going to go to Medicare.gov, that's Medicare.gov. And this is basically what your homepage looks like. Let's just click add at this. All right. So right now it's not open enrollment, and even if it was, I'm not going to go through with logging in and creating an account. But if this is your first time, you might want to go ahead and log in and create an account. For right now, we're going to start with finding health and drug plans. We're going to click on that. And again, I'm going to continue without logging in. Okay, so it's going to ask you to answer a few quick questions, and I have to say that as you walk through it, it really is pretty user-friendly because it's going to explain quite a bit along the way. So, what type of 2021 coverage are you looking for? It's going to give you all of your options. You could learn more about Medicare. You can look into Medicare Advantage plans, which is Medicare Part C. You can look into Part D, which is your prescription drug coverage. You can look into Part D plus a Medigap policy, also known as a Medicare Supplement plan, or just a Medigap policy. So let's start with the Medicare Advantage plan. Okay, so Medicare Advantage plan bundles all Medicare health benefits with or without drug coverage, plus extra services like vision, hearing, dental, and more. If you're going with a Medicare Advantage plan, please make sure that it includes some type of prescription drug coverage. It's not going to be very helpful to you or cost-friendly to have to purchase Medicare Part D on top of Medicare Advantage. That would be very, very silly. Okay, so now we're just going to enter a zip code, confirming. It's going to ask you get help with your costs from any of these programs. So that would be Medicaid, Supplemental Security Income, Medicare Savings Program, extra help from Social Security. So it's asking about Medicaid because then you might be eligible for a D-SNP. Medicare Savings Programs, we have a video that's all about that. Extra help is in reference to a program that'll help you pay for Medicare Part D. So we're going to say, I don't get help from any of these programs. Obviously, if you do, you would click one of those. Do you want to see your drug costs when you compare plans? So this is a great thing. If you click yes, though, you need to have a lot of information readily available to you. So it says, great, to see drug costs, get ready to enter the name, dosage, quantity, and frequency for each drug you take regularly. And then it's going to ask you additional questions. So I'm actually going to go back. Whoopsie. I'm going to go back because we're not going to do that. So here are the Medicare Advantage plans available. There are 53 plans available near me. And currently it's sorting them by lowest drug plus premium cost. So this one actually has a $0 monthly premium, a $0 health deductible, a $0 drug deductible, and a max $2,500. So as you scroll through these, you'll notice that perhaps they seem a little bit similar. Now here's the thing with Medicare Advantage. Medicare Advantage is not like Medicare Supplement plans in that your physician must accept your specific plan in order to accept you as a patient, in order to be considered an in-network doctor. With Medicare Supplement plans, if your doctor accepts Medicare, they accept your supplement plan. It doesn't matter who your carrier is. So when you're looking at Medicare Advantage plans, you are going to need to determine if the doctor and hospitals that you like to use are covered by that carrier. That's very, very important. Now over here, you can filter your plans. So let's say it's really important to you that you've got dental. Let's apply that filter. Okay, so now it's 46 plans available. Let's say it's really important to you that it's a PPO. 12. And over here on the right-hand side of the screen, it just gives you a really brief sort of rundown as to the important info. Now, if there's a couple plans that you're interested in, you can click on the Add to Compare. We're just going to do 3 random ones, these 3. And then it's going to let you compare them at a glance so that you don't have to keep clicking back and forth. So no premium. This one's got a $770 annual deductible. So the deductibles on this one are slightly higher. And then it's going to compare the benefits. So you'll notice that at a first glance, quite frankly, a lot of these plans seem pretty comparable, which is why we recommend that you go with a broker, because the brokers are really familiar with the histories of the company. You want to make sure that you're not going with a carrier that tends to dramatically and drastically hike up their rates on a year-to-year basis. I mean, obviously companies do tend to have increases, but you want to go with a carrier that has a history of low and stable increases. And specifically with Medicare Advantage, it's really important that you pick a carrier that, like I said, your doctors and hospitals of choice accept.
Otherwise, it's not going to help you very much if you have to travel very far to find a doctor that you like that's on your plan, or if there's none in your area whatsoever. So Medicare Advantage specifically can be a little bit tricky because of that, because in some areas, Medicare Advantage is great. It's really easy to find doctors that accept your plans. And in other areas, they're not so great, and you might be better served with a Medicare Supplement plan. Okay, so that's the basics here. Now, pardon my scrolling. Let's go back up, and we're going to go back. Okay, now let's look at just Part D. We're going to again say, I don't get any help from these programs. No. Now there's 28. This is going to work basically exactly the same way as how it did with Medicare Advantage when we were comparing things. Medicare Part D plans are also offered by private carriers. However, there is not the same flexibility as there are with Medicare Advantage plans. So even though Medicare Part D is offered by private carriers, there are certain guidelines that are set by the federal government. For example, there is a deductible that's set every year by the federal government. Now, your Medicare Part D plan can choose to waive that deductible or lower it, but it can't charge more than that deductible. So here we're going to see $445, $445. Let's see if we find any that have actually waived the deductible. Let's try this. So let's say I didn't want any deductible. That was what was really important to me. Well, look, here's a plan that offers a $0 deductible. So you can really, with the filters here, you can figure out exactly what it is that you're looking for and make sure that you sort of weed out the plans that you're not interested in. All right, now I want to show you something important, which is Medigap or Medicare Supplement plans. So we're going to click on this. Medicare Supplement plans are great in some areas. They're great in a lot of areas, actually, because like I said earlier, Medicare Advantage plans aren't necessarily perfect dependent upon where you live. Okay, so let's say I'm a 65-year-old female who doesn't use tobacco. Update prices. There are 12 Medigap plans offered in your state. So we have Medigap Plan A, B, C, D. You see where I'm going with this. F, F high deductible, G, G high deductible, K, L, M, N. Now these plans, Medicare Supplement plans, are standardized. I believe it even indicates that on Medicare.gov. So that means that if Medicare Supplement Plan A is the one that you want, you really just need to find the right carrier. You're not going to get different or better benefits dependent upon the carrier that you choose. And like I said before, if your doctor accepts Medicare, they accept your Medicare Supplement plan. It doesn't matter who your carrier is. You just want to make sure that you go with a carrier that has a history of low and stable price increases. So the most important thing is to figure out which Medicare Supplement plan is right for you. And it will indicate over here what the premiums, generally speaking, range from. So like A, it ranges, generally speaking, from $154 to $298 per month. B is a little bit more expensive. Now you're going to see as we get to F, that's one of the most expensive ones because it's the most comprehensive plan. We tell people to go for G a lot, especially because Plan F is being weeded out. Plan G is almost identical to Plan F. We have a video that's dedicated all to Medicare Supplement plans if you want to learn more about them. So now here's the thing. Let's say I do go with Plan G. That didn't work. Let's try that again. Plan details. So it's going to give me the breakdown of what Plan G covers. So let's see, I've read this and I've decided Plan G is the one for me. Well, here are some companies that offer Plan G in my area. It even tells you how they price it, the issue age pricing versus community age versus attained age. It looks like everything here is issue age. It depends on your area, really. Now, here's the unfortunate thing. If you're going with a Medicare Supplement plan, this is as much info as they're going to give you on Medicare.gov. Basically, then you're going to have to contact the company directly, which we do not recommend. You are not going to get any type of discount whatsoever by contacting the company directly. The problem is at that they're really only going to be able to present you with their company's, their carrier's plans, which is not ideal. It's much better to comparison shop. So we recommend that you work with a broker, specifically a licensed broker who does not charge you for their services. A broker works for you, not the carrier. An agent works for the carrier. Now, a lot of people, like I said before, are under the false impression that they need to, if they like Blue Cross Blue Shield, they like United Healthcare, that they need to go with a Medicare supplement plan with a carrier that they're familiar with. And that's really, really not true because, like I've said a couple times during this video, if your doctor accepts Medicare, they accept your Medicare supplement plan. It doesn't matter who the carrier is. You just want to make sure that they're reliable and that they have a history of low and stable increases. So at this point, you would have to contact the company directly or, like we say, contact a broker. Okay, so that's really how you would peruse the plans. Now I'm just going to go back to Medicare.gov and I want to show you some other things. So up here, you're going to find some really helpful articles and answers to some of your most frequently asked questions. So you're going to see, how much Part A costs, how much Part B costs, ways to pay your Part A and Part B premiums. You're going to find out if a specific test or item or service is covered. So it really is a very helpful website and it's pretty user-friendly. And then you're also going to find forms, help, and resources. So if you're looking to apply for extra help for Medicare Part D, or if you're looking to lower your Medicare Part B monthly premium, that's where you would find those forms. You can also search all providers and facilities. And of course, down at the bottom, there's even more information and links to other helpful websites.
So that's the end of our walkthrough today. But if you have any questions, like I said earlier, leave them in the comments below or give us a call here at iHealthBrokers at 888-410-0344. Now, of course, it's in your best interest to at least be familiar with Medicare.gov because there's going to be a time where you have a really important question and you just want the answer readily available at your fingertips. However, you don't have to use Medicare.gov to actually enroll in Medicare. We recommend that you contact a licensed broker, one that doesn't charge you for their services, to help walk you through the Medicare enrollment process. A broker is a third-party liaison who works on your behalf, and they'll help make sure that you get the right plan for your needs and you get the least expensive plan that matches your needs. So, like I said, any questions, you know how to reach us. And of course, please make sure to check out our channel for other Medicare-related videos. If you liked this video, please make sure to click like, and we'll see you next time. Bye-bye.